How you doing? What's sticking up so?
Just leave it in the bag, just so.
Good morning.
Might even be helpful for you to do that. Spread out all this. Summer step. And then, what else we got here? For later, if anybody wants excellent progress. And you're hearing it from kind of a beginner, not certified person, so you gotta bear with me and interject at any time. That Rich, you're totally wrong about that. So let me know. If you got any other ideas or suggestions, that'll help me, definitely. But I'm not ready quite yet until we get this thing working. And somebody give me a remote, or I know how to scroll through my flash drives. So where did that person go? Not here, okay. So, where, I'm not ready to plug in, I'm not gonna go with that. Okay, what time do we have to be out of here? 1 hour at the most? All right. All right. I want to know a little bit about each of you, so let's do that while we're waiting for that. So let's start with you. Great.
It's actually a Tala, he works for a welfare clinic over here in Tafuna. I'm married to him, and I work at the clinic.
Here, yeah. So I use your, that exam room back there for my wound care station, I think, right?
Yeah,
That
we
was
were
great.
very fruitful with one of our.
That was wonderful to be in there. You, sir.
I'm Nikki, I'm Nate, I work with Margaret.
Okay. How many, just raise your hand before I find out the rest of you, that work here at the health center?
Say it again.
Right here at this health center.
What's your
Introduce
question
yourself.
again?
How many of you work here at this health center?
Back and forth.
All right.
Back and forth.
And then, okay, back and forth, okay. And you, ma'am, what's your name? And what do you do?
My name is Telly Frost Hill. I work for Maternal Child Health.
All right. Ma'am?
Margaret Espasar, Director of Nursing.
Okay, great. And we've got Antonio, who's my assistant. We're all in wound care training ourselves right now.
Francine, I'm one pharmacist.
Great, I remember seeing you at the pharmacy. Yes, sir?
Brian, dentist.
Dentist, great. Dentist, all right. And you just got certified in wound care. Anybody else certified in wound care? All right, she's gonna take over when I can't do it, so. And you, sir? Primary care, great. Say again? One of the physicians, okay. And you are my fellow doctor friend? Great. Okay, so we'll get this started then. And my name's Rich. I'm actually from Colorado originally, and I've been living in Kona since about 1985. And part of who I am might be on a couple of these slides, so.
We got it.
Okay. All right.
Apologize for.
So what I've been doing since 21 years ago is I connected with Pastor Pele. How many of you were here when we were here for the clinic?
When was that?
Wednesday and Thursday. All right, so we had probably on our team, we had, all of our team was here then. So I think we had total from South Carolina, I'm from Hawaii, some other people, and about 8 Australians. I think we had close to 30-some people on our team. So praise God we had all those people. I want you guys to help us next year. We need your assistance, and especially if you're excellent in English and Samoan translation. And we are going to do it again and even have more of these products. So I am pretty much when I started was just filming what we were doing as the ministry, the Promise Keepers, a men's ministry, trying to help the churches have men's ministry in the churches. And then nobody was doing wound cleaning. We had 8 people on our team. And so I've had staph infections on my leg. I was put in the hospital when I was in high school for a stubbed toe that got infected, had my lymph node lanced, and for 7 days I was inside the hospital taking Physa-Hex baths. And so that is how I recovered from the infection of the staph. And then during our missions, now do we have
There's the mouse.
access to the flash?
There's the mouse there. You can use it to open up.
For my computer or the flash?
For the flash.
Okay, so where is the flash?
So if you just.
And where is my folder? Oh boy, this is gonna work.
And then you can use the arrows here to go between
Alright,
slides.
let's try. Okay, this will start. Oh, thank you. All right. So, again, when I started, was just cleaning basic wounds with just a little bit of knowledge I've had, and didn't really know about a lot of the products. And what I had learned about is in Hawaii, I was able to just use Physa-Hex, Q-tips, and clean my staph wounds, and then dry powdered polysporin. Has anybody seen the dry powdered polysporin before? Okay, so this here was very helpful to me when I first was starting out. But what's the one main thing? I'm going to go over 5 of the basic reasons and ways to heal a wound. And so what is one of those main ways that we have to heal a wound? Anybody got an idea? Shout it out.
Clean it.
Clean is one of them. What else? Keep bringing out some points here.
Assess.
I'm sorry?
Assess.
Say again?
Assess.
Assess for sure. Anybody else?
You do swabbing.
I'd say you gotta talk loud
You
though.
know swabbing?
Cover.
Cover it. All right.
Do the swabbing so you know what's bacteria.
Cleaning, debriding. Let's call it debriding. So yeah, in this example, what else?
Assess how bad is it? What
Exactly,
kind of
yes.
treatment do you need for it?
Yeah, assessment.
Your diet. Your diet.
And diet. You kind of want to ask them, are you diabetic? Because they're treating ulcers a lot of times, right? So if they're diabetic, and one of our doctors on our team said that if they have a reading of 200 or more on the sugar, their wound's not going to heal. Is that true? Or does that sound right? Is that pretty much?
Take a while, you slow, but.
Okay, so that's something I just learned as well. So, all right, here we go. I'm going to go ahead and go through them. But again, this is how I started, and using dry powdered polysporin was my first agent to kill the bacteria, and using Hibiclins. You can kind of see we had one tray here. So I had hydrogen peroxide in the water, mixed with water 50-50. I had soapy solutions. I had water tray, and a lot of the syringes. I had Hibiclins, Physa-Hex, and betadine, and so that's my cleaning materials I was using. How many of y'all think hydrogen peroxide is the thing to use for the wound? Amen, thank you. So the hospital, I hate to talk bad about anywhere, but I'm understanding the hospital is telling people to use hydrogen peroxide and clean your wounds twice a day maybe, not even diluting it either. So who works at the hospital, LDJ? Nobody, right?
Sometimes.
None of you, sometimes? Okay, so are they using hydrogen peroxide on cleaning wounds, the initial cleaning? Okay, now I believe the hydrogen peroxide as an initial wound cleaning is a good, good agent for debriding. But there is a product now that is so much better, and you're not destroying the tissue. The hydrogen peroxide is like battery acid to a wound, is what Nancy and Donna, the co-founders of the Wound Care Education Institute, where Maria just got certified at. We all have been raised to use hydrogen peroxide. So an initial wound cleaning, probably an okay thing to do. Would you say, Mary? Marie? Yeah, the bubbling and all that will help in the debridement. But after that, no more hydrogen peroxide, correct? All right, we're good on that. All right, so this is how I got started. I'm learning just like you guys, and every year I'm learning even more. Now, Tani has been another important part of my training and my teaching when I started on the wound care. And so, anybody have some simple remedies for the Tani besides taking the ketoconazole or the fluconazole, and what else are we using medicine-wise? Okay, and anything else? Okay, so I have also learned, you guys know about selenium sulfide? All right, so Nizoral is ketoconazole. So Nizoral is an excellent thing for the tonics, the skin. Selsum Blue shampoo. The selenium sulfide is the active ingredient, 1%. You can also get Selsum Blue for 2%, I believe, in the States. The other as well, which I don't have, is Head and Shoulder shampoo. Comes in the dark blue bottle. Selenium sulfide, it needs to have the selenium sulfide. And I've experimented with it. What I'll do is I'll just have them, sample a little bit, just a test area, and hopefully no reaction. And I haven't quite got the dosages down and the time to use it, but I just have them sample some, and if they don't have a rash or an irritation, then they can go, even in the evening before bedtime is the best time to do the treatment. And just do a thin layer. Take a shower, pat dry, and put a thin layer on it. And then you can leave it on for about 5 or 10 minutes, and then remove it, wash it off. And now you're shaking your head, yes. And so if I wanted to go to even a more extreme usage of this, how long do you think I could really leave a thin layer on without washing it off?
Now, the reason recommendation for something like this, if it's full body, you would put it on for about 10 minutes.
10 minutes.
Rinse it off.
And I agree with you too. I don't want to see any irritations. Now, the number one cause with rashes and irritations, perfume type of materials, and bad soaps. I guess you got the Protex, and what's the other really harsh one that they use? Dettol. My goodness, Dettol? Is that terrible stuff or what? I would think it's terrible stuff. So Dove soap, I think it's a low pH. You want to use a low pH, no perfume material, all right? So I have done Selsum Blue on a friend of mine here in Pongo, Alfred Seui, and I did his back over in Apollo at the hotel one night. And I went ahead and I just, did, this is not him, but he had the same similar, and I put a thin layer, and as soon as I touched him with this stuff, he goes, oh, that's burning. And I come to realize after I did a full coat on him, he was really irritated, and he went into a full rash and ended up peeling off his skin. It definitely did the Tani treatment, but it gave him a bad irritation, contact rash. So you gotta be careful with it, is my feeling on it. We agree?
Yes.
All right. All right, so that's another thing that God really had me start on. I guess I'm sideways here.
Question.
Yes, sir.
A lot of times, especially in Apia, they use the Vitanic, which is a salicylic acid.
Okay.
Sometimes up to 10% strength.
Okay. And I thank you for that, because I have had a couple packs of salicylic acid in my bag. Didn't know what it quite was used for. Now it's also for acne?
They use it for Vitanic. They call it Vitanic and even Vilafa.
Okay.
For fungus and stuff.
Okay, great. Thanks for telling me on that one. I need to know that. All right, so anyway, these are kind of the treatments I've been using for the tonic. And then going with the ketoconazole, bad stuff for the liver, right?
Yeah.
200 milligram once a week.
Yeah, so there's an FDA alert on the ketoconazole PO tablet. So we have actually discontinued it here on our
Right.
formulary. We don't recommend it because of the liver toxicity.
Right. So now it's the fluconazole is what we were prescribing?
Yeah.
Okay.
But there's still some ketoconazole in there. So.
Oh, yeah, right. And the Nizoral is ketoconazole, but probably
So
okay, right?
topical is
1%?
okay. Yeah, topical is fine.
Okay.
But once you do the PO.
Right, so the reason why ketoconazole would be bad is liver damage, right? Correct?
Yes.
Okay. Okay, so let's keep on going here. So Rich was laying down here, but I took a picture. I'm actually treating this little spot right here. About 3 or so weeks ago, I went to the dermatologist, and I'm on blood thinners, and he was gonna do this surgery on it, and I said, you remember I'm on blood thinners, don't you? And he goes, oh, really? And so he decided not to do that and then did the face cream. I can't pronounce the name of that, but just pretty much a skin chemotherapy is how we treat it, or had treated it. And you can see I'm applying the cream then. And this was about, say, 2 weeks later. So I guess the cream will get to the cancer areas, the cells, more than it would the skin cells, correct? I got one shaking head. And so about 2 weeks later, this is my condition. And both sides I was doing it. All right, so to kind of finalize this, I did the 2-week treatment. I went to see him. He says, okay, Rich, hey, I just read about this new material that you can mix, the steroid cream and the antibiotic ointment cream as well. And you can mix that 50-50. And so that way you don't have all the redness, and it'll take care of all your redness and irritations as well. So I swear he told me to mix it with the same stuff I was starting with for the 2-week period. So I went to the pharmacist and I said, yeah, I've already got the stuff that starts with an F. And he goes, you got that already? I said, yeah. Okay, we'll just give you the other one then. So they gave me the other one, I mixed them 50-50, and I started putting that on. And I'll tell you what, I was 3 times worse than that the next day. And I was lucky on Friday, I called him real quick and I said, how many times am I supposed to use this? Because it's really showing up a rash almost. She goes, Rich, what, are you mixing those other stuff you had before and the new stuff? I said, yeah. She goes, no, don't do that, So I got a scolding on that. And she's trying to get home, so that made matters worse. She called quickly to the pharmacy and they got me the other stuff. 3 days later, I was able to get it the day I left to come over here. So anyway, you can see I cleared up. So I learned on that stuff.
Excuse me, what was wrong with your face? What was on your face?
Well, I had a little basal or pre-cancer spot right up here.
Oh,
And my mom, or my dad, my 2 brothers, we all have it on the right side.
okay.
So anyway, that's, hopefully I don't have to have it removed. Okay, so another important case that I was helping with when we did these medical missions, we had seen this gentleman come to our clinic, definitely elephantiasis, and he had taken his medicine. What's the name of the medicine you give at the schools and all that?
BBC dinosaur.
Okay, so you're doing that once a school year?
Not anymore.
Not anymore. No more treatment?
Well, after the CDC and the WHO, when they came and did that survey, they only happened to find 2 active cases. So we were under we were not giving up that medication, but we still have the steroid.
Yeah. Okay, so if you diagnose that they have filavirus, what are you doing then for the patient?
We treat them.
With what?
Diethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethylmethyl
gentleman, and he definitely had, his medications installed, or definitely stopped the larval growth in his body. So I think I've seen him maybe 15 or so years. We try to see, every year we go back and give more, bandaging materials, everybody okay with some nasty looking wounds? Anybody in here wants to close their eyes or don't wanna see it? You're all good, right? Okay, so I got a few of them in here, but you can see we're starting to get ulcerations, dragging the leg on the floor. Now, I asked, at the wound care conference in Las Vegas in September I went to, and the co-founders set me up with a lot of the exhibitors, and I was also a room monitor, so I was able to go to all my classes. And this Coloplast company donated this moisturizer material and some body wash material for his specific case. Unfortunately, the day before we were gonna go over there, I found out that he passed away around Christmas time, 2 weeks after his wife passed away, so he was very depressed and he died. So that's Pomai Sakalia, one person that really influenced me and to continue on. And then, of course, all your, staph infections, ulcerations, things like that. We see these all the time, the impetigo. So we're treating all those. Now, let's see what we got. All right, we got sound or no sound on this system?
We do.
And I want to pause, and I can't pause. So do we have audio with this at all?
Yeah, the bottom right hand corner next to the monitor, there's a speaker.
That one?
Yep.
If it's on the flash drive, it is on the flash drive, so, and your muting, we don't have a mute. Anybody able to help me get audio on this one? Because this is the most important part. So if you want to play around and try to get audio working. Okay, so let me go back to what I'm going to present right now with this video, and if all fails, I'll play it on my little screen and have the audio working. The anisette material. This, you saw my wound care trays with the syringes, all those different cleaning solutions. And when I went to that conference, met the lady, the co-founder, and I gave her my video that we do a highlight video, and she saw those trays for wound cleaning. And she emailed me and said, Rich, I know a product that you can use that you can get rid of all those cleaning solutions, all those materials you're using. And this is just a one-in-a-bottle material. And it's this stuff right here, anisette. It comes from a gentleman named Wally in California, and Anacapa is their company. Now this stuff here kills bioburden, the film, right? That the bacteria will grab, the bioburden's like Velcro, and then you got your bacteria that just gets held on by the biofilm. So check this out. This is sodium hydrochloride. You know Dakin's, right? You know Dakin? Is that sodium hydrochloride? Dakin? Yeah? Okay, so with a little bit more, a few other little materials inside that. All right, so the kill rate on this stuff is amazing, and I'm going to pass this brochure around. But let's say in 30 seconds, and I can't pronounce these. Anybody good with pronouncing these? But definitely MRSA, 30 seconds, 100% kill rate. VREs, the CREs, the methicillin, yeah, the MRSA, all these other, like 10 other things on here. I'm going to pass this around to you. 99.9999%, 100% kill rate in 30 seconds with this material. So you use this as a topical spray, kills the bacteria, it destroys the bioburden film, and you can use it as a topical as well. The thing is, don't use it and don't let it pool, but you spray the wound. And then you'll let it dry, you know, a couple minutes or so, and then you can actually put some on your little Band-Aid or on your gauze and cover it. Now, they also provide a gel that is a dressing change once a day type of material. And I'm going to go ahead and pass this. I got 3 brochures of that. And this one here is another brochure that goes with the anisette. That's the one and only one of those I have. So they have the gel that you'll see in the brochure. Is it going to work?
Sorry.
Okay.
Yeah,
So Anthony, can you describe to them real quick the silver stuff versus the gel? Anthony's still in the room?
Yeah.
So we use the gel for how many days? If we have the gel.
3 days.
1 day.
Oh.
Once a day dressing changes. And then the silver set.
Silver step is 3 days.
Okay, so you can use that on a wound for up to 3 days. So that particular material is key to killing the bioburden. That's your main thing. All right, let's try this. Okay, I'm going to bypass the Meta Honey right now and just go straight to the Anacapa.
Hi, I'm Nancy Morgan, co-founder of the Wound Care Education Institute, and I'm with Wally Rogowinski. I hope I said that right, Wally. And he's the president of Anacapa Technologies. Thanks so much for being here, Wally.
Well, thanks for inviting me. I certainly appreciate it. Anacapa Technologies is a small veteran-owned business that's been chartered to develop new kinds of products. We specialize primarily in anti-infective agents that we're developing for a specific purpose, for skin and wound care. We have some unique features about our product that address the emerging problems in wound care today.
Okay. Well, you know, speaking of emerging problems, you know, I have been hearing the buzzword biofilms. Would you mind just explaining what biofilm is to us?
Biofilms are a unique an important factor in wounds, in the wound environment. Biofilm is a very complex organizational form of bacteria as it colonizes a wound. The biofilm begins first by attaching to the surface of the tissue, and as a matter of fact begins to form this architecture. This structure has the property of being able to resist antibiotics, antimicrobials, and antiseptics to a large degree. The best way I can show you is an electron scanning micrograph of biofilm. If you notice in that corner there, you notice that fuzzy material back of the bacteria?
Yeah.
Well, that almost acts like Velcro in attaching to the wound, holds it there tenaciously, so it's very difficult for anything to get through.
So what do I have to do to get rid of these biofilms?
A product like Anicept, which contains sodium hypochlorite and is stable and non-cytotoxic, it's a modified sodium hypochlorite, will break down biofilm, kill the bacteria, kill the fungus, kill the viruses, and be able to remove that biofilm so that the wound can again resume its healing process.
So this is knocking out biofilm in
Yes,
these
it will.
chronic wounds?
Yes, it will.
Oh my goodness.
This has been recognized by the CDC as the primary product to eradicate biofilm.
Oh.
As a matter of fact, the FDA said that a product like Anicept can be used outside the patient for non-critical medical devices, equipment, surfaces around the patient. So it has a dual use.
Are you saying that I can use this in a wound, okay, to get rid of my biofilms, but I can also use it on surfaces like in the patient environment?
Yes, you can.
So I have a dual purpose. It's like 2-in-1.
Also, we have a long-acting version of Anicept. It's essentially the same formula, but it's a slower release. And that way you can keep it in the wound longer, maintain a moist environment, but also get rid of that biofilm over a longer period of time, as well as debride the wound. And quite frankly, it's unmatched for odor control in wounds.
Oh yeah, well that's...
So it knocks it
That's
all
good.
down. A lot of that biofilm produces that odor that is characteristic in a lot of wounds.
So I have a cleanser, and I also have a hydrogel, and this I would use on at least daily basis, right?
Yes.
In the wound bed?
Once a
Okay.
day, no more.
So this is the ammo to get rid of these biofilms.
There you go.
Okay.
There
Well,
you
this
go.
is great.
And slough and debris as well.
And a chemical debrider agent.
Yeah.
So where would I go, Wally, to get more information?
You would go to our website, which is www.anacapa-tech.net.
You just found me a new weapon to get rid of biofilm.
Oh, good.
Yeah.
Good.
This is awesome.
All right, so now this is the awesome material to use for debriding and also triple, or not triple, but the antibiotic ointment as well. So again, the gel is changed once a day, and this here is changed every 3 days. Sound like a good product? This is awesome material, and you can spray your tables and all this stuff.
How much is the product?
This one tube, I have to double check my price list, but I think this is around $20 a single tube. Now the Anicept spray, you have somewhere about $8 in a case, $10 individual. You can now start getting it online too. When I first ordered it about a year ago, they wanted to know if I was healthcare professional or a facility, and they did let me use it as just a wound care on the mission team. So I do see it's online now. All right, so that is an awesome product. Boy, I sure hope that they can get this audio going, because the meta honey is another important. How many of you know about Manuka honey and meta honey materials? We got to show this. How was the audio on this? Was it okay for you? Yeah, you all could hear in the back? I can do the same thing with the meta honey. I'll try to key it up the same, just a little bit off. Would that be all right with you? Let's go straight to the meta honey then. And I don't have my little extra speakers. Any questions while I'm trying to do this?
Yeah, I have a question.
Go ahead.
Is it the Anacapa or?
Right. Anicept is the material. Anacapa is the company.
What is the main ingredient?
Sodium hydrochloride.
Hydrochloride.
Right.
Meta Honey HCS, come on.
you have a wound that's been septic for a while. Would that also,
It is awesome. Bobo.
Yes.
Hey, Anthony, talk about my fellow patient Bobo. And Bobo, you want to explain what happened? I need to locate the file here.
Go ahead.
Bobo is a case study on using the Anacept on a first-degree burn that we experienced. So you see on his arm, and also show him your chest. We happened to, the other night after the clinic here, he and I went up to sightsee up to the top where the Rainmaker is, and we had a engine fire on the vehicle. So go ahead, what was going on?
So after the mission here on Thursday, I think, we were on our way home. I guess we got home too early and no one was at the house and the house was locked. The house was locked. So I decided to take Rich sightseeing. So I took him up to Tafuna. On the way up there, the car started to smoke up. So I made it to the top. And when I got to the top, the engine was smoking up.
Overheat.
And I small kind of panicked. And I opened the engine. And I opened up the hood and the engine was on fire. And right then and there, we both kind of panicked and we got scared the car might blow up or something. And then we started to look for water. We couldn't find any water, so we were sourceless. But then I noticed that the only water we had was the antifreeze coolant. But then I knew that if I tried to open it, it burst out and it would blow up. So what I did was I grabbed the ear. And then I covered the cap and I slowly turned it, and then everything happened so fast, and therefore I got hurt.
Show your stomach.
Yeah,
Show your stomach.
it's my arm and my stomach.
Okay, now I was hoping to use him a little bit more of an example after we watched these other two presentations. But right now, instead of doing the silver sulfidine, which the hospital put on him, we went straight to the silver set material. Okay, and he took a shower this morning, and now it's been exposed. We've had good results so far. I've seen it starting to show a lot more redness, probably because he's getting irritated. All right, so there's the 5 most valuable rules and concepts to heal the wound. So we've pretty much already talked and brought them up. So what's the cause of the wound? All right, so it was the antifreeze and the hot water. First-degree burn now, right? We removed the cause, right? We're away from that situation. And so now we're ready to start treating. So they, at the hospital, I'm not sure if they did a little wash or rinse or anything on you. All we know, bottled water we were spraying on him to get him to the hospital. And so I'm not sure if they debrided any or just put the silver sulfidine right on. All right, so we've done that part. Number 2 is to keep it warm. Right now, he is stalled or stopped his healing process because he's dropped the temperature of that wound by 2 degrees. When you do that, you have affected the healing of the wound. So and I'm looking for a temperature gauge, but at Home Depot, Antonio, see if it might be in that first aid kit in a black bag. But they have these little temperature, like the laser beam temperature things, and at the Wound Care Institute, they brought this out. You use those little temperature things, and you shoot the temperatures around the wound, and if it shows an increase in temperature, it's probably on the effective side. So that's another little trick. So we're trying to keep a wound warm. When we start putting the material back on and get him insulated, bandaged to insulate, and to cover the wound and provide that dressing, it's going to take about another 4 hours for him to get back up to a healing temperature, correct? So when you drop the temperature by 2 degrees, or you're keeping on bandage in open air like this, he is now stalled and stopped it. See if you can check a little reading on there. So you want to check like the outer perimeter, outside the wound first, and then you see what your temperature is, and then go to the wound.
Everyone on the outside,
All right, so, you know, he's probably on the infective stage now, trying to go there, correct? We're not fighting the bacteria, correct? All right, so I'm gonna run through these. I'm sorry. Most ideally, you want it at body temperature. When we do an abdominal pad on him, and we're putting the silver set to keep following up, and get that abdominal pad on there, that's gonna provide some good insulation. And it's gonna bring up the temperature again, and try to get close to body temperature. Then it'll start the healing again.
Body temperature.
Right, because where'd the healing come from? The body? Okay, what is inside your body that heals a wound? I've got a perfect example for you, folks. Come on now, what's gonna heal that wound, or any open sore, or any wound you have? Vitamins are a good one. That's kind of back to saying the very first thing you want to try to do, or the last thing you want to do, is find out holistically what's their nutrition. You're not gonna heal a wound if you don't have good nutrition, correct? All right. Here's, everybody go to McDonald's and get these wonderful cream pie, cherry pies. How many haven't had one of these? Okay, these are great. So if I'm assessing, go ahead. All right, so if I'm assessing a wound, this is a great wound example, correct? It's, say, a laceration now. What do you see is going on with this wound? What's your assessment?
The edges are almost exposed.
Right?
Probably clean it, suture it so that it'll heal.
Okay, now, how many hours can you suture a wound, a laceration? Within 24? Okay, I gotta talk to my doctor, she says less. I believe a day or more. Maybe you're lucky if you can. I'm sorry? 3 to 4 hours is kinda, I believe, yeah, I heard maybe up to 6 hours. You maybe possibly up to a day, I don't know. You guys would know better than I would. Okay, so we've got a pretty good looking wound here, correct? And we know it's a laceration. If we can stitch it, we will. If we can't stitch it, what are we gonna do then? Say again? Butterflies, good. Now, a lot of lacerations and things like that, if you try to close the wound too much, you could cause a skin tear. And you may cause more damage to the outer perimeter of the wound, so be cautious with your dressings. That's another one. I noticed that cloth tape we have has the serrations, and that is not only to help you break it off real easy, I believe, but it's also like if you're doing a conforming bandage and you stretch that, it'll rip at that seam. So that's why another thing they put those serrations on that tape. All right, anything else you think might be something we should be concerned about with this if we're gonna clean, maybe do the suturing or do the butterflies, or just go ahead and provide our moisture, our triple antibiotics, or the, we remove the bile burden, we cleanse it with hopefully the antisep, and now we're ready to bandage this. Is that where we're headed to next, or is there something else to consider? I'm hungry, you guys. Tell me what else to consider here. I need your activity. Anybody see something else inside there? The white cream of this wonderful pie is right there. Nobody thought that there could possibly be some tunneling problem? More escar, right? It sure is good. You guys got to go to McDonald's and get something. But anyway, we didn't treat the tunneling problem of, say, staph infection inside there, right? All right, so just so you know, you've got a possibility there's also more infection down there. And you take your Q-tips and you get down deeper. There's a Debersoft. Anthony, you got a Debersoft pad back there? There's this new material, Debersoft. It's excellent for, if I had this orange, and I don't have really a lot of time left, so you use this Debersoft, and we'll open that and pass that around. So this here is like a gauze pad. It's got these microfibers to it. And you moisten it with saline solution or water. Just soak it real good. And then you'll take this like a chalk eraser, and you put it on the wound. You know, kind of rub around. It's non-irritant to the granular tissue. and take it right off. And you'll see these little charts here. Look at the slough and material on this Escar stuff. Let's put that slough, that pussy biofilm on top of there, right? And using the Debra Soft, look at what it did. Amazing product. So I'm going to pass that around to you. Let's go to the Manuka honey right now.
So you're gonna supply us with all that so we can try it?
I wish I could. I've tried. I'm going back in September to thank them. I am leaving you guys some things. When we leave here, whoever your supply manager is, will help you guys with this. All right, so let's try and see if we can cue this at the same time I cue that one.
Fascinated by how we might be able to use honey in the fight against the many forms of bacteria that are becoming resistant to treatment with antibiotics. To find out more, I visited microbiologist Rose Cooper. So how do you go about testing these properties that honey could have?
We've used a number of techniques, and one has been to look at the changes in the structure of the bacteria using electron microscopy.
Electron microscopes can magnify a staggering 10 million times, allowing scientists to see exactly what effects the honey has on the bacteria. In some cases, the results have been really astonishing. Honey doesn't just reduce the number of bacteria, it also halts their progress by stopping them reproducing. To reveal how, Rose shows me inside the cells of the dreaded hospital superbug, MRSA.
These are untreated bacteria. They're quite happy, they're rounded, they're growing, and they will divide every 30 minutes.
I like the idea of happy bacteria, by the way. It's a bit of a contradiction in terms, but
Yes.
carry on. Okay. So,
and this in fact is treated with honey, and you see that these bacteria have accumulated with this cross wall. They can't divide. So the honey is stopping these bacteria dividing, and if they can't divide, they can't go on to form an infection.
and this is honey acting alone. This is honey without any antibiotics.
That's right. That's just Manuka honey on its own. It seems to have different effects on different bacteria. This is another gram-negative bacterium that causes wound infections. And here you see this is the honey has caused these holes in the wall of that bacterium. Now that bacterium will almost certainly go on now to rupture.
So they're not going to survive, really, are they?
No.
That's quite a dramatic effect that you've shown me that honey has on bacteria. Do you know what's doing that? Is there a kind of active ingredient in honey?
Many honeys, when you dilute them, there's an enzyme in the honey that's produced by the bee, and when you dilute the honey, it's activated and it starts to break down glucose and produce hydrogen peroxide, which in itself is an antiseptic.
Because that's what the bees use to turn the nectar into honey,
yes,
isn't it?
That's right. And I suspect that there are more bioactive ingredients in honey that won't be discovered yet.
It may not be the cure for every bug, but the evidence is growing that honey does have an impact on some bacteria. But beware, the honey used is specially prepared for medical use, so don't try this at home.
All right, so Meta Honey is a very important product, and we're starting to learn a lot about it and using a lot of it. Definitely comes from the Leprosporum pollen from the tea tree, Australia and New Zealand. Powerful material when used on bed sores. That when I was scrolling through there, you saw my friend who had some ulcerations, and there's a calcium alginate back there. It's like the gauze pad. When you get down here, you want to look at those, and you cut it to the same size as the whole of the wound. You don't want to have it laying over the margins, and it'll cause maceration. There is a gel, hydrogel material with the honey in there, and you can lay that over the irritation or the wound, and then you're not going to create the maceration. It'll also take a lot of exudate into that material as well. This homeless person that I had in a couple of slides, he had his bandages on for 5 to 7 days on 2 rounds of dressing changes, and no maceration, but he healed up in 3 weeks. It would have taken him a month to 2 months for sure on the healing. All right, so I'm going to go through the 5 again real quick, just because I think we're missing something. So we removed the cause. We're now keeping it warm. That's what we need to do with Bobo. And put on the triple antibiotic ointment, kill bacteria. Meta Honey could be used for that. I don't think topically it would work as effective. For sure, I know that as the Silvercept on Bobo's wound. But when you start doing those packing of the pressure ulcers and deep wounds. It's powerful stuff. And what it's doing is going to be the next slide. We got to do that, or the next video for sure. So these are the type of dressings.
MetaHoney HCS combines the healing properties of leptospermum honey with the absorption capability of a superabsorbent polymer technology, absorbing 2.5 times the amount of fluid as other leading hydrocolloids. There are both adhesive and non-adhesive types of MetaHoney HCS, as well as a fenestrated version for wounds around lines, tubes, and pin sites. These dressings absorb light to moderate amounts of exudate and are used for dry to moderately exuding superficial to partial thickness wounds. This dressing may contact healthy peri-wound skin without concern for peri-wound maceration. After properly cleaning and preparing the wound, we are applying MetaHoney HCS adhesive dressing onto this skin tear. To apply MetaHoney HCS adhesive, first remove the film backing. Position the dressing over the wound and affix to the skin. Remove the top film covering from the dressing, making sure the entire adhesive border is firmly in place. Again, after cleaning and preparing the wound, we are applying non-adhesive MetaHoney HCS onto this partial thickness burn. To apply, first remove one side of the film backing of the dressing. Because of the large size of this dressing, fold it in half to better position it properly over the wound site. Affix the first half of the dressing onto the wound. Then gently affix the second half as you remove the film backing. Smooth out the dressing to assure complete contact with the wound site. On larger wounds, such as this, you may want to use BioGuard large gauze roll for added protection.
I'm so sorry we just didn't get this audio working. But you see how it killed those bacteria? And that was key to stop the growth.
MetaHoney HCS combines the healing properties of leptospermum honey with the absorption capability of a superabsorbent polymer technology, absorbing 2.5 times the amount of fluid as other leading hydrocolloids. There are both adhesive and non-adhesive types of MetaHoney HCS, as well as a fenestrated version for wounds around lines, tubes, and pin sites. These dressings absorb light to moderate amounts of exudate and are used for dry to moderately exuding superficial to partial thickness wounds. This dressing may contact healthy peri-wound skin without concern for peri-wound maceration. After properly cleaning and preparing the wound, we are applying MetaHoney HCS adhesive dressing onto this skin tear. To apply MetaHoney HCS adhesive, first remove the film backing. Position the dressing over the wound and affix to the skin. Remove the top film covering from the dressing, making sure the entire adhesive border is firmly in place. Again, after cleaning and preparing the wound, we are applying non-adhesive MediHoney HCS onto this partial thickness burn. To apply, first remove one side of the film backing of the dressing. Because of the large size of this dressing, fold it in half to better position it properly over the wound site. Affix the first half of the dressing onto the wound. Gently affix the second half as you remove the film backing. Smooth out the dressing to assure complete contact with the wound site. On larger wounds, such as this, you may want to use BioGuard large gauze roll for added protection.
Okay, so you saw how those are effective. Now, if you're doing, say, the deeper tunneling ones, everybody doing okay?
No.
Okay, go ahead.
You've seen that wound, right, with the honey, whatever it is, the adhesive.
Right.
And then they put another gauze around it. Question is, how long would you leave those things up?
Well, you could leave that up to 5-7 days. It's just amazing, yeah. So really what you're doing, and here's the brochure as well, you're doing about 3 different things that might have been described. Osmolarity is a term of what it's doing is drawing moisture from the body to the wound, providing your moisture, all right? That's big, that's key, providing moisture. A dry wound's a dead wound. You're also lowering the pH of the wound. You're getting it out of the alkalinic side where bacteria love to breed, and you're getting it into a low pH. That's why Dove soap, low pH, is good for cleaning wounds.
But my question really also has to go, what is the healing rate for this product as opposed to other products?
Well, comparing to other products, I am not the sales rep type of a person. I'm not probably that knowledgeable in that part of it, just what I've seen it do over the last year. And I am going to provide you guys with a flash drive that has all these Wound Care Institute video webinars that we have. So you can watch these 1-hour webinars, and then you'll probably get your answer out of those. Would that be an okay answer for right now, so we can keep moving on that? I'm sorry, again?
And give me that video drive
and some samples.
And a few samples.
You know what, I was really blessed yesterday. We didn't have any of our materials except a handful of things that I brought, maybe a few that were sent from the States that were donated. All my good stuff was in those red bags over at Pastor Asawa's house for these last 2 weeks, and I just got them last night. And I've scored. I got the big gallon bag full, 20 pounds worth of the MediHoney material. All right, now here's a problem that I may have with it. Some of it's expired and outdated, and our mission is not, in a sense, or really not allowed to donate these to you if they're expired. We will sort through there and get you the stuff that is non-expired. I'm going to keep the expired, all right?
I'll take some of your expired.
I'm sorry I can't without Pastor Pele's permission and approval. I just have to put it at that, okay? I really can't. I know that would violate our agreement we have with the government and our medical mission. So we just say it as that and keep going, okay? Sorry, but I'm gonna go back in September and I'm gonna try and get as much sent to you guys as possible. That's my key mission after this. All right, we gotta keep going because I got 10 minutes. All right, so definitely we're at step 3, we're keeping it moist. Let's do the paste real quick. This one right here is helpful.
MediHoney paste is 100% active leptospermum honey. Like the gel, it comes in a tube and can be used on a variety of wounds, from superficial to full-thickness wound, ulcers, burns, and wounds around the mouth. This sterile product has a thinner consistency than the gel, which is very suitable for deep, tunneled wounds or for wounds with undermining, or even for impregnating onto a clean antimicrobial gauze or non-adherent dressing and then applying to the wound. It is recommended to use MediHoney paste with a secondary cover dressing, except in cases like certain burns or mouth wounds where your clinical judgment comes into play. As we demonstrate on this model of a sacral pressure ulcer, after properly cleaning and preparing the wound, MediHoney paste can be applied directly to the wound bed. This model is an example of a more serious wound, where tunneling and undermining has occurred. In cases like this, it is important to make sure the MediHoney dressing has direct contact with the varying wound surfaces. Here, we use BioGuard packing strips to move MediHoney into the tunnel, ensuring contact with the undermined area. In cases like this, it is important to make sure the MediHoney dressing has direct contact with the varying wound surfaces. Here, we add MediHoney calcium alginate to cover and fill the wound bed, being careful to keep the product inside the wound edges. If the depth of the wound requires it, gauze may be used to further fill the wound bed. To finish, we use Extrasorb non-adhesive foam as the cover dressing to offer absorption, cushioning, and protection.
So then you would cut the calcium alginate and fit it inside the wound as a packing gauze. Cover dress that as well, so it's level with the surface of the skin. Insulation pad provides the warmth, keeps the moisture in there, collects any slough and escarpment or an exudate coming out. And yeah, leave that on for about, I've seen my homeless guy, he forgot to go back to the clinic 6 days later, and I thought for sure he was going to be gangrene and heavily infected. Amazing, it was like half the size. I saw him change the dressing again, and 2 weeks, or a week later, 7 days he went that time, and he was almost completely healed up. Amazing product. All right, so definitely number 4 was managing the bacteria. That's what this is doing. It's also providing with the healing process. Again, in their information, the video, they said that it kind of creates a hydrogen peroxide effect too, mixing with the wound juices. Again, we don't use hydrogen peroxide, but if it's doing that and providing a natural hydrogen peroxide, you're killing bacteria as well. So you're antibacterial with this material, and you're providing moisture, the key components of the process too. All right, number 5, feeding the wound. Definitely good nutrition, good diet. All right, so in conclusion, the 5 ways to heal a wound is remove the cause, avoid changes in wound bed temperature. There's my best example back there right now. Wave, Bobo. And just before he took a shower, it was amazing how much different that was, but now it's starting to get irritated and possibly heading towards infection. That blister opened up on him Saturday, so we're going to get on to treating him and covering that again. Treat the bacteria, that's the next thing we got to do with him with the Silvercept before we do the dressing, and adequate nutrition. So basically that's it for my presentation, but these webinars you're going to be able to access are just awesome material. When you go online and you would pay for it, $10 per 1 hour seminar video, then you get a certification as well. I'm not certified yet, but I'm headed towards that. And how much, $2,000? Oh, say again. $5,000 one?
5.
Okay, yeah, 5,000 every 2 years for recertification. That's one of the main reasons I'm not getting certified right now. But for $500, shark debridement, very important. That's your next class. And I monitored that class. And so just the scalpel work, the slicing, the dicing, providing the moisture, and then softening the tissue, and much easier to remove. We ran into those situations. But on this other video that I don't have time to show you, and I have the information, I'm just gonna, the 12 or so barriers to wound healing. So let's start real quick with that one. We also have information about the top 10 products, and when you leave here, you'll be able to see some of that material. So barriers is I see what I did. All right, so the inappropriate moisture balance is number 1. Number 2, variable wound temperatures. Number 3 is bacteria. And you want to reassess after 2 weeks, whatever your treatment is. And if that's not working, out the door, try something else. Number 4, etiology, the cause of the wound. So repositioning, pressure ulcers, all that. You want to work on your repositioning, support surfaces, compression, and adaptive equipment. Number 5, nutritional compromises. So you got to provide the right calories, proteins, multivitamins, avoid dehydration. Number 6, the necrotic tissue removal. Got to get rid of that stuff, right? So that's with your dressings, your ointments, by irrigation, sharp debridement. Santo is another excellent product. Flushings. Number 7, decreased oxygen levels. So your underlying problems are screening for anemia, vascular consult, debridement of necrotic tissue, control wound exudate, hyperbaric oxygen treatment. Number 8, medications can cause some issues with your wound healing, so you got to work that out. So vitamin A can be taken systemically or applied topically to counteract the effects of corticosteroids. Number 9, slow or absent epithelial edge. Open wound edges. So epibole is the rolled over edges of a wound, right? So when you get those rolled over edges, you're not allowing the epithelial cells to migrate towards the center, which is how your wound heals. The margins must be re-injured to renew the wound healing edges. So a lot of ways you can do just manually, scratch it with your gauze pads. How about the sticks, the nitrogen sticks or whatever they are? What's that? The cauterizing material? What's the name of those sticks? We'll figure it out sometime. But definitely the Q-tip, you can do that, but there's like silver nitrate sticks, yeah. That's another possible way I understand what they were teaching us. You can actually stimulate that wound to start healing again. All right, so pack the dead space. Again, fill it to the depth of the wound surface. Fluff, not stuff. Number 10 is the underlying disease. Treat the illness at the same time. If there's diabetes, you got to do glucose control. Pneumonia, infection. Arterial disease, increased circulation. Number 11, non-adherence. Stop smoking, drinking, bad food, blah, 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 right? All right, so number 12, inappropriate dressings. Choose the product based upon the tissue type, the exudate, the location, patient needs, underlying causes. Treat the high bacteria areas first. And I think number 13, I don't think we have a 13. So those are the 12. All right, I did it. I have 1 minute left. The silver step? No. This is more of the sodium hydrochloride material with a gel and silver material in it. One thing to be aware of is you use the antiseptic spray, but you don't use AG dressings, silver material dressings. So those two are kind of incompatible. You use the sodium hydrochloride of the spray, you put the silver dressing on, you change it to sodium chloride, I think. And you deactivated the sodium hydrochloride of the antiseptic. So no silver dressings with that. But you use this product by the same company that has the silver material in it. And your key, you got the silver killing agent in there. Silver dressings, you all kind of, we have back there, but any of my silver dressings are the ones in the black packages. You definitely have to add moisture, water to them, saline solution, drinking water, and all that stuff. And yeah, he's holding one up. Anthony, did we have any of the Silver Lawn materials, those dressings, the sheets, the big sheets? Okay, now there's another material, and I don't think we brought it, but it's like a t-shirt, like this right here. Anthony, this type of material, remember?
Yeah.
But I can't remember packing that in. But Silver Lawn is an awesome material, silver sheets material with the silver in it. And so you with the water, the moisture, you're creating ionization, which kills bacteria. And you can put like those silver dressings over there. They say, maybe, let me see. But you can leave those other dressings on for 21 days. If you're out in the military in the field, this one here, probably not, yeah. It's an AG dressing though, it is a silver dressing, yeah. So, yeah. But it's the cloth material. And so what you do is you cut it and you lay it over the edges about, say, a ½ inch to 1 inch past the margins. Definitely your moisture is very important, and cover dress that. So you created the ionization killing the bacteria, but there's something to do with this electrical charging system. It's like jumper cables to a battery. You're having electrical current jumping across this material, this silver material, which some technical way is killing bacteria as well. All right? So any other questions now? And again, definitely look at those products. We'll have like the Meta Honey open sample that you can look at, smell it. You can even taste it. It's good, the gel and stuff you can ingest. Good for ulcers, your bacteria or some problems with your mouth. You can take that gauze pad and put it inside there. Antibacterial. It's a multi-product. Very amazing. We started out using, yeah, here it is. There's the silver dressing. So that's rolled there. We did not have any packing gauze on our mission, so what we did is we cut a little strip of packing gauze and we stuffed that into a tumbling wound.
How do you use this?
You can cover dress, cut it to the size you want, a ½ inch to 1 inch past the margin of your wound. You can cut little gauze strips out of it. You can take that after you want to do a dressing change, put it in your kitchen sink or the sink, and stretch it and get rid of your exudate and reuse that stuff. That's how antibacterial that stuff is. Amazing. Now dressing changes. You guys have so much expense with dressing changes. These new products are what's going to eliminate a lot of that expense. This is what's so key about this in the last couple of years. Providing less dressing changes at a cheaper expense for the patient and the hospital as well. What am I forgetting, Maria? Pretty good? Hey, y'all, thank you so much. We'll try to do round 2 next time.
Yeah, yeah.
Well, it's an answer to our prayers that we want to be able to work with you, and follow up is key this year, and now start to provide you with some excellent products. You guys pray for connections with the exhibitors and the distributors and the Wound Care Institute. They want to hear about this, and we're going to really see some good stuff happen. Thank you so much. We have a first aid kit. We will do a, yeah. Anthony, I have a patient for you. How about cleaning and some silver set and dressing change on her?
Can we take that? Is
it covering a wound?
No, it's muscle.
Okay, I don't have the tape with me. I don't have the physical therapist kinesiologist girl with us. She is over with our team right now. Are you working here today? Yeah. We're over at 9 o'clock over at the elderly. Yeah, can you get over there and have her look at you? Next to the prison, the building where the older people are, the building we're going to go to out of this, next to the prison, the blue building. Anybody know the building that where the elderly patients are next to the prison?
I do.
Okay, so Anthony, tell her the name of that place.
Yeah.
So, did you get the how about experimenting? I'll do an example. Orange like that. And I can't let you take this right. So I got it. Where are you going?
Great home care.
Well, don't leave yet. Don't take my products yet. I'm going to give you something because I still have to save some stuff for the presentation as well. Whatever you can get. The east side is pretty far. Yeah, the east side. Let's go. Okay, can you get a gallon of coffee? I got a gallon. Just do that.
Hey, don't take the part yet.
Ah, you got it. Let me give. I have to give. Okay, come this way. All right, what else? Anything? You got the Deborah saw, so use that as a tester?
want somebody, you go and give it.
Okay, now, hold on a second, ladies. Who works here at the health center?
Right there.
Okay, I will distribute it to you personally.